Ever wondered how the health of your mouth, teeth, and gums could affect your general health? Well, the truth is, oral health is a window into your overall well-being. It's a lot more important than many of us might realize. The state of our oral health can offer valuable insights about our overall health. How so, you may ask? Well, our mouth is the primary entry point to our digestive and respiratory tracts. It's a bustling metropolis of bacteria, most of which are completely harmless. But like any city, without the right maintenance and care, things can start to go wrong. When we slack off on our oral hygiene, skipping the daily brushing and flossing, the bacteria in our mouth can reach levels that might lead to oral infections. We're talking about familiar foes like tooth decay and gum disease. But it doesn't stop there. These oral infections can provide a sneak peek into other health issues that might be lurking in the rest of our body. Now, let's throw medications into the mix. Certain medications, such as decongestants, antihistamines, painkillers, diuretics, and antidepressants, can reduce saliva flow. Saliva, our unsung hero, washes away food and neutralizes acids produced by bacteria in the mouth. It's like our mouth's personal cleaning crew, helping to protect us from microbes that multiply and lead to disease. So, when saliva flow is reduced, our oral health can take a hit, which can then ripple out to impact our overall health. In essence, our oral health is a complex, interconnected system that plays a crucial role in our overall health. It's a delicate balance that our bodies strive to maintain, but sometimes they need a little help from us. That's why good oral hygiene is so essential. It's our contribution to keeping that balance in check. So, maintaining oral health is not just about having a radiant smile. It's about keeping your entire body healthy. In the grand scheme of things, that daily brush and floss go a long way, not just for your pearly whites, but for your overall well-being too. But how can problems in your mouth affect the rest of your body? This question might have crossed your mind, and the answer is more intricate than you may think. Let's take a journey inside your mouth, a bustling metropolis of bacteria. Most of them are harmless, but being the entrance to your digestive and respiratory tracts, your mouth can become a gateway for disease-causing bacteria. The body's natural defenses, along with good oral care like daily brushing and flossing, usually keep these bacteria under control. Yet, when oral hygiene slips, bacteria can reach levels that may lead to infections such as tooth decay and gum disease. Now, let's discuss a lesser-known hero of oral health: saliva. Imagine it as a ceaseless river, washing away food particles and neutralizing harmful acids produced by bacteria. It's a vital part of the body's defense system against disease. However, certain medications, including decongestants, antihistamines, painkillers, diuretics, and antidepressants, can reduce saliva flow. With less of this protective fluid, the risk of disease rises. But the connection between oral health and overall health doesn't end here. Studies suggest that oral bacteria and the inflammation associated with a severe form of gum disease, known as periodontitis, might contribute to certain diseases. For instance, conditions like diabetes and HIV/AIDS, which lower the body's resistance to infection, can make oral health problems more severe. Moreover, oral health issues have been linked to other health complications. For example, some research suggests that heart disease, clogged arteries, and stroke might have connections to the inflammation and infections that oral bacteria can cause. To sum it up, our oral health is intricately connected to our overall health. A problem in the mouth can have far-reaching effects on the rest of the body. This means that oral health is a crucial part of our overall well-being, influencing and being influenced by other health conditions. Did you know that your oral health can contribute to various diseases and conditions? Indeed, an array of health concerns can be traced back to your mouth. Let's delve into some of these. First up is endocarditis, an infection of the inner lining of your heart chambers or valves. This typically happens when bacteria or germs from another part of your body, such as your mouth, spread through your bloodstream and latch onto certain areas in your heart. In other words, poor oral hygiene could potentially put your heart at risk. Next, we have cardiovascular disease. While the connection is not fully understood, research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. Your mouth might be more connected to your heart than you realize. Pregnancy and birth complications also find a place in this list. Periodontitis, a severe form of gum disease, has been linked to premature birth and low birth weight. So, maintaining good oral health is not just about the mother's well-being, it's about the baby's too. Lastly, let's talk about pneumonia. Certain bacteria in your mouth can be pulled into your lungs, causing pneumonia and other respiratory diseases. So every time you neglect your oral hygiene, you could be inadvertently inviting lung diseases. This is by no means an exhaustive list. Other conditions that could potentially be linked to oral health include certain cancers, rheumatoid arthritis, and an immune system disorder that causes dry mouth, known as Sjogren's syndrome. Each of these conditions underscores the importance of good oral health. So, the next time you think about skipping your toothbrushing or flossing routine, remember that the implications can be far-reaching. It's not just about avoiding cavities or gum disease, it's about safeguarding your overall health. Your mouth is a window to your overall health, and it's crucial to keep that window clean and clear. Clearly, the impact of oral health extends far beyond the mouth. It's a key player in your body's health narrative. So, let's give it the care it deserves. In the same way, certain health conditions can also affect your oral health. Diabetes, for example, reduces the body's resistance to infection, putting your gums at risk. Gum disease appears to be more frequent and severe among people living with diabetes. Research shows that people who have gum disease have a harder time controlling their blood sugar levels. Regular periodontal care can improve diabetes control. HIV/AIDS is another condition that can impact oral health. Oral problems, such as painful mucosal lesions, are common in people who have HIV/AIDS. These conditions can make it more difficult to eat, speak, and maintain good oral hygiene, which in turn can further compromise overall health. Osteoporosis, a disease that weakens the bones, is linked with periodontal bone loss and tooth loss. Certain drugs used to treat osteoporosis carry a small risk of damage to the bones of the jaw. This is why it's important for those with osteoporosis to be extra vigilant about their oral health to prevent complications. Even Alzheimer's disease, a condition primarily associated with cognitive decline, can have an impact on oral health. As Alzheimer's disease progresses, oral health often worsens. This could be due to a combination of factors, including cognitive decline leading to neglect of oral hygiene and potential side effects of medications used to manage Alzheimer's. Other conditions that might impact oral health include eating disorders, rheumatoid arthritis, certain cancers, and an immune system disorder that causes dry mouth, known as Sjogren's syndrome. All these conditions can lead to complications in the mouth, from tooth decay and gum disease to oral infections and dry mouth. It's crucial to tell your dentist about the medications you take and about changes in your overall health, especially if you've recently been ill or you have a chronic condition such as diabetes. Your dentist needs to know about these conditions to provide the best care for your oral health. This two-way relationship between general health conditions and oral health further emphasizes the importance of maintaining good oral health. After all, a healthy mouth is a key component of a healthy body. Now that we understand the importance of oral health, how can we protect it? Let's dive into that. First and foremost, the cornerstone of oral health is regular brushing and flossing. Brushing twice a day with a fluoride toothpaste and flossing at least once a day will keep harmful bacteria in check and maintain a clean oral environment. Remember, consistency is key here. Next, let's talk about regular dentist visits. It's recommended to visit your dentist at least twice a year for routine checkups and cleanings. These visits not only give your dentist a chance to spot potential issues early, but also provide a thorough cleaning that you can't achieve at home. Don't shy away from the dentist's chair. It's your ally in the fight against oral health issues. Now let's not forget the role of a healthy diet. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help keep your teeth and gums healthy. Try to limit sugary snacks and drinks, as these can lead to tooth decay. And of course, drinking plenty of water throughout the day helps wash away food particles and keeps your mouth hydrated. Last but certainly not least, it's crucial to inform your dentist about any medications you take or changes in your overall health. Certain medications can affect your oral health, and your dentist needs to know about these to provide the best possible care. Similarly, if your overall health changes, say you've been diagnosed with diabetes or another chronic condition, your oral health care may need to be adjusted accordingly. In conclusion, protecting your oral health involves a combination of good daily habits, regular professional care, a balanced diet, and open communication with your healthcare providers. It might seem like a lot, but remember, every little bit helps when it comes to maintaining your oral health. Remember, your oral health is a window to your overall health. Keep it clean, keep it healthy.